Do I start? Morning all. I'm Dr. Vicky Harmer and I'm consultant nurse for breast care at Imperial College NHS Trust. So essentially that's Charing Cross and St Mary's, Western Eye, Hammersmith Hospital, Queen Charlotte, etc. But mainly I work out of Charing Cross Hospital where the breast unit is. I'm delighted to be here to join you. I hope today this next session will be fun. There is a section where you can ask questions down at the bottom, so please, if there is anything, do type away. This technology is slightly over my head, but I'm sure you guys have it all absolutely smashed. So I'm going to talk a little bit about what it takes to make a great nurse. Also going to talk a bit about what I've done and a bit about career agility. So if that's all right with you, I shall begin. So I've worked in breast care for about 18 years now, and as a nurse specialist first and foremost, and then latterly as a consultant nurse, and absolutely delighted and very passionate about what I do. Hasn't always been plain sailing. I wasn't what you call a natural nurse. It wasn't something that I planned to do. I was a little spirited at school and similarly at university. And so I lost a couple of years retaking A-levels, and also there was a chance that I was supposed to redo some exams at university, and having missed a year out for retaking my A-levels, I thought that would be 2 years that I would have lost out of my career. And it was actually my dad. He said, "Oh, so then you'll be a nurse." My parents are both doctors, and so I sort of grew up with that and hearing their sort of stories on Christmas morning, going with my mother and my granny, my sister, to the hospital, you know, back in the 80s, the 70s and 80s. And that, yeah, so my dad said, "Oh, so you'll be a nurse." And I thought, "Oh my goodness, are you mad? No chance." But I became a healthcare assistant and I loved it. I loved the odd hours. I loved the sort of team spirit. It was just absolutely wonderful. So I put in for my nurse training at the Middlesex Hospital in UCH. I was the first of the Project 2000 that were there. So that was the old diploma programme. And then immediately afterwards, I thought, well, now I'm sort of studying, let me top up for the degree. So I actually came to King's to do the degree. And again, it was not plain sailing. I certainly remember, I mean, it's lovely to be back now, but I do remember sort of being in tears outside the library when it was time to hand in the dissertation, because it was just all quite overwhelming. So that, I think, is to normalise that, I think, is good if any of you are feeling a little stressed. Then I went on at my level of nursing. They said you needed a master's. This is in 2002, but they didn't specify in which subject. And I think now you can cleverly do little modules, can't you, that sort of build up to make your master's. But I decided that they were dropping in these business managers, and I thought, well, let me be a funny hybrid. So I decided to do an MBA, so Masters in Business Administration. So I did that. And then more recently, I did my doctorate in healthcare, so at King's as well. So that took about 7 years and was extremely tough. But I had the most wonderful, wonderful supervisors. And again, so and was, you know, really proud and really pleased that I had done the study at King's, because it really truly meant something. So I guess I'll tell you a bit about career agility, what it takes to be a good nurse, milestones and challenges. I mean, I've said a little bit about how I sort of stumbled into nursing, but I really, as I said, sort of took it like a duck to water. I did the usual surgery. I did oncology to start with, and then surgical oncology, and then I thought I'd do a bit of ITU to sharpen up my skill set before becoming what we used to call F grades, which is so you're like your junior sister, on a surgical oncology ward. In those days, they did sort of breast and bowel, and we also, well, now there's a high dependency unit, and I think we had it there, but just not the monitors. And then the secondment, it was maternity cover for a breast nurse specialist came up, and I knew the girl wouldn't come back to it. So I thought, oh, that's my chance, because for my first degree, I had the dissertation was about women post-breast radiotherapy feeling quite abandoned. So I thought, oh, this is what I fancy. This is me. But of course, it was maternity cover, so it was only 9 months. And I knew that afterwards I would have to, if I wanted to go for the job, they'd be like, well, why should we, you know, what have you done in the last 9 months? I thought, oh my gosh, I've got to do the all singing, all dancing 9 months in order to hopefully be employed again. And the opportunity just dropped in my lap. Honestly, it was amazing in the sense that, first and foremost, BBC Radio 4 contacted me via a charity on the programme called The Archers. I'm sure some may have heard of it. I'm sure maybe some of your mothers listened to it. Because one of the characters was having a breast cancer storyline. And I think because I'd started to try and get out and about a bit, you know, turning up to meetings in the evening, you know, drug company meetings or anything, you know, anything that we could go to that was slightly relevant, I'd go along to and, you know, show a bit of interest. Put the energy in, I think, enthusiasm, the initiative. Anyway, so this charity contacted me and they said, would you help with the script? So I was like, absolutely. And it was so interesting in the sense that you go through the scripts to make sure that they're medically correct. Now, of course, they're not documentaries, so there is a little bit of artistic license, but essentially, you know, just to sense check, because you don't want to scaremonger if something's on breast cancer, you don't want people to be terribly worried, but you want to get the facts across. So I did that, and then on the back of that, I thought, let me write to Nursing Times and put something in their letters page about the process, because it's quite unusual, I thought. And I did, and we did that in Nursing Times. And then they said, oh, will you write a few articles? So I thought, okay, yeah, because that was quite a good way of learning, you know, like with doing your assignments. I had just started in breast care, so I was sort of looking, oh, let me look up surgery. So I did an article on surgery and then wrote it down and published it. And it was a series. It was, you know, I was very lucky again. But you have to, of course, have the, you know, enthusiasm. This is on top of the day-to-day work. Again, really lucky that on the back of that, a publishing company contacted me and said, would I like to write or edit a book? And so that's now, we've done 2 editions of that. And I'm supposed to, once I get the energy, do a 3rd edition, but I put that off for a little while. I shall come back to that in the new year. So I think, so I was really lucky with that. And then, of course, you know, in the meantime, you're really sort of, once you know this information, you're really trying to educate the rest of the workforce. So do bedside teaching with healthcare assistants, try to get the energy up, you know, trying to get the enthusiasm. Because, of course, you know, if education is something that people feel nurtured about, they feel a little bit cherished, you know, certainly by the bedside, and that will increase quality patient care. Other things that I've done, of course, for breast cancer, we've had Breast Awareness Month, haven't we? And so again, I would suggest, you know, energy, enthusiasm, and there's like, it's like a pink tsunami, isn't it? October often, the pink cake sales, there's pink ribbons, Wear It Pink Day, etc. So we have got a really good vehicle in order to, you know, get the message out there to the public, to reach out to people and encourage, you know, breast awareness, and also the NHS breast screening programme, which we have. I think what makes a good nurse is communication. I think communication is vital. Certainly leadership is about the person, it's not about technology. Funnily enough, I was at a meeting last night and I said to one member of my team was there, and she said, I said, oh my God, I've got to do this thing. What makes a good nurse? And she said, a strong bladder. So that is something I said. She also said a sense of humour, and that when she had gone to nurse training, that was one of the questions, which was what makes a good nurse. And it turned out that the overwhelming resounding answer was a sense of humour. And I guess especially, the nursing landscape and the NHS, it's tough. You have to have your resilience, emotional resilience. You have to look after yourself. And I think a sense of humour and kindness, compassion within the team that you work is vital, 200% vital. I think it's very easy to forget that. I think maybe traditionally as nurses, we haven't been that kind to ourselves or that helpful. I don't know why, but to try to encourage each other and really nurture and support and be a good mentor, I think. I think it's vital. I think it's vital, especially, as I said, sort of the nursing landscape at the moment. What else have I done? I'm trying to think. I've done quite a lot of media work as well, and similarly, you've got to try to sounds a bit odd, but sort of brand yourself, and you've got to deliver on what you do. I was very lucky, again, Coronation Street had a breast cancer storyline, and it was Sally Webster. She's done her okay story, so I'm not breaching any confidentiality, but I think that was kind of like the biggest health promotion that was ever done, because we had her, Sally, going through mastectomy, chemotherapy, radiotherapy, having really tough problems with her husband, physically and all that. And then, of course, we had to diagnose on Christmas Eve, which you would in Soapland. And the actress thought, oh, actually, she had a lump. And so she went to her GP and was diagnosed with breast cancer. And again, that her storyline has been out in the press, so I'm not breaching any confidentiality. But of course, then we had to recraft the scripts because we had this whole ambitious storyline, and she's gone off for a year to have the very same treatment in real life. So, oh my goodness, so we started recrafting it all. Oh, you've just missed her. She's just in the cabin. And but again, that was quite fun as well. And then I did Family Affairs. That was a program which was on Channel 5. And the funding was cut just as they had diagnosed someone. So again, that was quite difficult to try to say, oh, because it was a well-loved character. And so they wanted her to go off into the sunset, oh, yes. But we had to diagnose it. So we had a bit of sort of scrappling around to try to adjust and tweak. And that was quite fun. I suppose more recently, I've done you may know, you may not, the EastEnders storylines. There's a couple of them, actually. We had Carol Jackson, who had breast cancer, and she had the surgery and the chemo. And then we had the genetic, because Sonia Jackson, her daughter, has got the genetic mutation. So we had to really sort of make sure that the storylines worked. That we dropped in, that Max had to be tested as well, because it was men as well as women, any sibling. And again, going on set, that was really fun. It was to try to, it was after the operation, her operation, to help with movements and how she would be. And I took up a couple of old sort of drains, so that they knew what equipment would be realistic. And again, not to scaremonger, but again, to get that middle ground. And then I did recently Peggy Mitchell, Barbara Windsor who played Peggy Mitchell, died, didn't she, of metastatic breast cancer. And so we did that scenes, and it was great fun, of course. Can you imagine working with her? And again, all just because my nursing career, and nurses, I think it's the profession is great. You can be so agile. It just shows, you just need a bit of enthusiasm to sort of get a little niche for yourself, and then people, if you've got to deliver, hey, people will come back and back. I suppose, and that's interesting. I also did a film with Tony Collette and Drew Barrymore called Miss You Already. I don't know if anyone's seen it. I think it's 2004. 15 it came out, and that was quite interesting. They work 10.5-hour days, and that translates to only about 6 minutes of film footage. But again, that was really fun, really exciting, I think there are challenges for you guys who are coming up to being qualified, or those who have just recently qualified. I think there are challenges very much in the workplace. I think, as I said, compassionate and kindness is, it's the bee's knees, if you like, and also to have good leadership skills. For the nurse specialist, there's 4 pillars to the job, isn't there? It's not just the clinical, it's not just knowing sort of red flag symptoms or triaging patient needs or giving them sort of information and support throughout each modality of their treatment trajectory, them and their loved ones, as it were. But it's also educating ourselves. We have a lot, right, lifelong learning, isn't it? Certainly, I've got plenty that I need to learn as well. And also educating others. There is a responsibility, I think, of including people within the workforce, and really nurturing them and bringing people on, really. You have to be a bit clever, I think, these days. I think the educational budget has been, certainly at the trust within which I work, it's been sort of sliced in half and then half again. And so you have to look for any study days which are free, so pharma ones, or if there's free places through certain schools, they suddenly, keep your eyes open and take the opportunity. No one's going to do anything for you. I think that's the end of the day. I think you probably know that now if you've studied at King's. I was probably speaking to the converted and the great students, but no one's going to do anything for you. You have to physically do it yourself. And if you do it with a smile, it's so much easier for everybody else. I think patient expectation is a little bit, we certainly, cancer, we have the patient experience survey, and there is a mismatch between expectation and what we can deliver. So again, it's trying to think of how we can box clever, how we can work a bit smarter without compromising patient care, and the patient should be at the centre of everything that we do. Other things that you can do, because the patient is the expert of themselves, and something that I did, which was really fun, was ran a support group for about 12 years. I'm still in touch with some of the ladies now. We would meet every month in the evening, and it would be fun and informal in the sense of we would have tea and cake to start with, vital component, always have refreshments. And then we would have a session. So we'd have a talk like it's relevant or appropriate in the sense, one time one of the surgeons came and gave a talk on reconstruction, because of course within the sort of 18 years, 19 years that I've been in breast care, so much has come on, reconstructive wise. We've got some really ambitious reconstructions that move flesh from the abdomen up to the breast, and some, it's incredibly exciting. It's incredibly exciting time. And certainly, I think I did my doctorate on the effects of radiotherapy after these ambitious breast reconstructions, and what the patient thinks about the combination of treatment, because there was some inequality about what people were being offered. So that was the support group. We had a surgeon coming to talk. One time we had guide dogs for the blind, who were just like, come. We did craft evening, made cards, and we know from literature that patient to patient, that peer support is one of the most important. It's one of the most valuable. And so that ticked all the boxes. It also kept me fresh and knowing, really, hopefully, sort of rebathing in what patients are experiencing, because it's not only after treatment, is it? It's them normalizing. It's a new normalization. It's them getting used to the new them, really, letting the dust settle, and again wriggling out of any issues that we can help with, really. And so that was really great fun being in the support group. And again, we would have some laughs doing tombolas for Breast Cancer Awareness Month, etc. And again, that would add energy and excitement. I mean, hospitals, they are obviously very serious places, and but again, to have, like, we did book sales regularly, or tombolas, you know, sort of would sort of get the excitement and a sense of community, I think, is what I'm saying. We've had stands on Paddington train station. I've been to Wormwood Scrubs, to the prison, to give talks to their the wardens. I've done that a couple of years, and then one year I brought the CNS for urology, who gave a little talk also. So we had, like, for the women and for the men. But of course, breast cancer can be found in men, so lion's share is women. Yeah, and so it's really trying to think creatively. Also, every October I contact local businesses and say, you know, do you need anyone to come in to give a breast cancer awareness talk and about breast screening to any of your staff, you know, to really make noise. And often you know, the places I've been, extraordinary. Harrods staff restaurant, Marks and Spencer. I helped Marks and Spencer actually design their swimwear for the post-mastectomy body, and of course that has come on leaps and bounds. Again, when you're as old as me, you remember if people had mastectomies, some of the support bras for afterwards, they were really chunky, and now, and they're similar to swimwear. I mean, really. Whereas now we can get some really sort of pretty stuff, really, and fashionable stuff as well. Why must we be dowdy and cumbersome in our post-surgery bras? Well, we don't anymore, and we aren't. So that, I've been very, very lucky with that. But again, you know, it's sort of reaching out to places, doing things. Also with the Royal College of Nursing, you put your head, you know, you try and push yourself a little bit forward and get involved, because you're going to be doing the job anyway, so you might as well sort of really embroider yourself within the topic. And I think actually I've really been lucky that I found what I love, which is breast cancer and breast care, breast awareness. I've written a lot of articles for Nursing Press, and again, if you do that, it's amazing that I don't think that many people do that. I think it does take time, of course it does, but it's something that can be quite easy to get into. Certainly, rather than thinking, oh, well, I'll do this whole article, you might want to do something, say, for the comments page, the comments bit at the front, so an opinion piece, which is, you know, a good, nice little way to get into it gently, you know, without having to think, oh my goodness, this is going to be a Herculean task. But yeah, and so also I got involved with the Royal College of Nursing. They do a number of forums, and yesteryear there was one which was the breast cancer forum, and then that merged with the cancer one, so it was breast and cancer. And so every year we would put on conferences, annual conferences. So again, you meet up. It's sort of a way of giving back, but also of getting a richer experience for yourself, because you network with people. There was, I remember, you know, I still see her now at things, the girl from Manchester, and you would all sit around the table. Someone from Southampton would all sit around the table and we'd start to think, oh, what can we do? You know, what publication can we do for the Royal College of Nursing? You know, we did one, I think, on competencies. We did one on standards, nursing standards for the nurse specialist for breast care. And again, so it sort of help with national standards and national nursing agenda. So again, it's sort of being out and about, and it is, yeah, it's career agility. I think it's all about attitude. It's about motivation. Try and be upbeat, etc. And try to stay fresh. I think actually what I'm sort of coming around to is that all of this extra business that I do and I choose to do keeps me fresh. It keeps me updated. It mixes things up a bit. It's exciting, yeah. On the back of, you know, some of the national work, again, then other invitations come and you think, wow, and to chair, and again, if any of you get a chance, chairing is quite a good way in to conferences, because you are there and you just do the beginning and then sum up, but you don't have to deliver the lecture, because that I can imagine, and still I get a little bit anxious about that. But again, so if you could get the opportunity to chair anything, even just within the teams that you're in, then that's a really good way of gaining confidence, of trying to sort of communicate with people. And then again, I've just been extraordinarily lucky, done a lot of teaching, and I've done a lot in the Middle East, because of course the world now is so accessible. I've been out there, I think about 5 times. I was in Kuwait, it's only for a day, and then Jordan for a day, and Oman I did, and Saudi 3 days, and Dubai a couple of times, and Oman. Because of course, it's ridiculous to just keep this knowledge to ourselves. If we know a little bit about something, let's share it. Don't just keep it, oh yes, I know this, but I'm not telling. No, share it. And again, that's what sort of makes things a bit funner, because you have interactions. And certainly I learn by the funny things, not by sort of a didactic lecture. I learn by someone, oh yes, and now someone said that, didn't they? And oh yes, and that's quite a good way to remember. I think nursing is a wonderful profession. I do think you need resilience. I think you need to be purposeful in what you do. You have to be clear. You have to think about your objectives. And I think you have to develop your own niche. You have to keep up the momentum, and just try to have fun. I think have fun, be kind, be compassionate, and try and get out there. I think that's my message. It's been a real pleasure. It's been a privilege and honour to come and do this webinar. I'm not sure whether this is what you're expecting, but it was a brief sort of snapshot of what I've done. I think we'll end with a quote from the History Boys. I don't know if it's something I love. I keep very close to my heart, and it's pass it on, pass it on. That's the most important thing I would say with any nursing care, with any tips and tricks you gain, with any experience. Just pass it on to people. Let's gather momentum. Let's gather enthusiasm. So, with that note, I'm going to say thank you very much indeed for tuning in. This is a wonderful platform that King's have got here, and I hope some of what I said has been useful. Good luck in your careers.